Batch 2, and I'm studying at Isabela State University main campus. For today, I'll be demonstrating the proper suctioning of newborn. But first, let us know what is suctioning. Suctioning is the extracting of mucus and fluids from baby's nose and mouth. And the purposes of these are to remove excess secretions that obstruct the airway, to facilitate proper breathing and ventilation, and to stimulate coughing. So, let's start the procedure. First, we need to identify and assess signs and symptoms indicating the presence of upper airway secretions, such as gurgling, respiration, and drooling. And we will verify the doctor's order. So we will assess. Okay. So the purpose of this is physical signs and symptoms may result from decreased oxygen to tissue as well as pooling of secretions from the upper airway. Next, we will explain to significant others how this procedure will help to clear the airway and to relieve some breathing problems. And also, we will explain that coughing and gagging is normal. So, the purpose of this is for the significant others to relieve their anxiety. So, Mr. and Mrs. Panganiban, this procedure that we'll be doing to your baby will help her to clear her airway and also to relieve her from breathing problems. And ma'am, coughing and gagging is normal. So, relax, ma'am and sir, and we'll be doing this procedure for your baby's sake. Next, we will enumerate and prepare the necessary supplies that we need before the procedure. So, these are the materials needed. Of course, we'll be needing a portable or wall suctioning machine. Here we have a sterile suction catheter for nasopharyngeal suctioning, and we have a young power suction catheter for the oropharyngeal suctioning. And we have a sterile water or saline solution. We have a sterile basin. We have sterile and non-sterile gloves, or towel. We also need eye protection or face shield and face mask. So, the rationale for this is to save time, energy, and effort. Next, let us assemble the materials needed. This is to ensure preparation and procedure efficiency. So, let us assemble. Next, we will position the client. We will adjust the bassinet to our comfortable working position. Okay. So, we will place the neonate to a semi-fowlers with the neck hyperextended, allowing maximal breathing during the procedure. So, then, we'll place the conscious client with gag reflex for suctioning into semi-fowler's position with the head turned to one side. While for the unconscious client, we will place them in a side-lying position facing the nurse. So, the rationale for this is to gag reflex prevents aspiration of gastrointestinal contents and positioning the head to one side, and hyperextending the neck promotes a smooth insertion of catheter into oropharynx and nasopharynx. So let's say that the patient is conscious, so we will place the patient into a semi-Fowler's and we will turn her head to one side. And then next, we will close the door or we will pull the curtains. So let's say that I'll be going to close the door. So the rationale for this is, of course, to provide privacy and security to the client. And next, we will place a towel under the client's chin. This is to prevent the bed linen from soiling because of the secretions. And the towels can be discarded when it has secretion. So we will get the towel and we'll place it under the client's chin. Okay, next, we will select the appropriate suction pressure for the client and the proper suction unit. So our suction pressure is 50 to 95 mmHg or millimeter mercury. This is for the infants. The rationale of this is to decrease the possibility of mucous membrane and hypoxemia. Next, we will wash our hands. This is to Next, we will wash our hands. This is to avoid transmission of microorganisms. So, we will wash our hands. So we're done washing our hands. Next, we will do the suctioning. First, we will do the oropharyngeal suctioning or simply the mouth suctioning. We will suction the mouth before the nose. This is to prevent aspiration if the baby should gasp when the nose is suctioned. So before doing it, let's put this one, the oxygen mask to the baby. So we will carefully put it so that the baby won't hurt. Then we will wear our eye shield. First, we will apply non-sterile gloves. This is to prevent infection. Here are our gloves. So we will wear it. Next, we will connect the one end of the connecting tubing to our suction machine and the one end to the Young Pure suction catheter. So this is our portable suction machine. So as you can see, I'd already placed it, and the other end of the suction. We'll be needing this one. So we will open. This is the Yann Cuber suction catheter. So we will place it at the end. And then, next we'll be removing the oxygen mask of the baby if present. This is for the proper execution of suction. We will put it here. So we have a dummy mouth here. So as you can see, these are the gangs up and down, and this is the top. So let's get our Yann Cuber suction catheter. We will insert the catheter inside the mouth along the gum line to the pharynx. And then we will move the catheter around the mouth until the secretions are clear. This is to provide continuous suction. Okay. Care must be taken not to allow the catheter tip invaginate the oral mucosal surfaces. Okay. So let's say that it is done. So after that, we will return the oxygen mask of the baby. This is to facilitate proper breathing. And then, next we will rinse the catheter into the water or saline solution in the basin. So let's get our water. So we will rinse this until connecting tubing is cleared from secretions. So let's get our saline solution. This reduces the transmission of microorganisms, and clean suction tubing enhances delivery of set suction pressure. Okay, next we will reassess client's respiratory status. This will direct nurse to initiate or cease the intervention. If there's a problem observed by the nurse, we will continue suctioning. And if there's no problem, we will move on to our next step. So, let's say that there's no problem with the respiratory status of our client. Next, we will remove the towel. And we will place it in the laundry. The next, we will remove our gloves. And we will dispose it in receptacle. This is to reduce the risk for infection transmission. And the next, we will reposition our client into safe position. This is to facilitate drainage of oral secretions. the basin with warm soapy water, and then we will dry it with towel. Next, we will place our catheter into clean and dry area. So let's put it up. Then after that, lastly, we will wash our hands. This is to deter the transmission of microorganisms. Next, you'll be doing nasopharyngeal suctioning. This technique involves using the airway of the nose to remove the secretions from the upper airway. First, let's remove the oxygen mask. First step, if indicated, increase the supplemental oxygen to 100% as ordered by physician to reduce suction and to induce hypoxemia. So let's say that we adjusted it to 100%. After that, let's get our suction catheter. We will open our suction catheter package and do not allow the catheter to touch any surface other than its package. This is to maintain medical asepsis. Then after that, let's get our basin. We will fill the basin with 100 ml sterile water or saline solution. Saline is used for cleaning tubing after each suction pass. We will open our lubricant. So this is our lubricant, KY Jelly. Let's open it. And we will squeeze it into the open catheter package without touching the package. So water-soluble lubricants is used to avoid aspiration pneumonia. Then after that, we'll be going to apply clean gloves to each hand. Or, we will apply clean glove to our non-dominant hand and sterile glove to our dominant hand. This is to maintain sterility of our catheters. So after wearing our gloves, we will pick up the suction catheter with our dominant hand without touching any surface. And then, next, for our non-dominant hand, we will pick up the connecting tubing. So for our suction catheter, we'll be using the green one. This is 5 to 8 French, and this is for the infants or neonates. So we will secure the catheter to the tubing. Then, after that, we will check if our equipment is functioning properly by suctioning a small amount of sterile water or saline solution from our basin. Okay, let's try. So, it suctioned smoothly. So after testing it, we'll be doing the rule of the thumb, which is the distance from the tip of the nose to the base of the earlobe. So let's check it. This is the nose and this is the base of the earlobe. So the measurement is 10 centimeter. After that, we will coat our catheter 6 to 8 centimeter with the water-soluble lubricant. This is for easier insertion and to lubricate, of course, our catheter. Without applying suction, gently but quickly insert the catheter using the dominant thumb and forefinger into nares using a slight downward slant or through mouth when client breathes in. Okay? Do not force through nares. For the pharyngeal suctioning, we'll be using 4 to 8 centimeter of the catheter. While for the tracheal suctioning, we'll be using 8 to 14 centimeter of the catheter. And then, we will pull the catheter back 1 centimeter before applying suction. The rationale of this is application of suction pressure while introducing the catheter into trachea increases the risk of damage to mucosa as well as increase the risk of hypoxia due to removal of oxygen present in the airways. Next, apply intermittent suction up to 6 seconds. Remember, 6 seconds of suctioning by placing the non-dominant thumb and forefinger to the vent of the catheter. Okay, let's count 1, 2, 3, 4, 5, 6. And then slowly withdraw the catheter while rotating it back and forth between the dominant finger and thumb. Okay. This prevents injury to mucosa, and suctioning more than 6 seconds can cause cardiopulmonary compromise. So, let's do it again. 6 seconds of suctioning. 1, 2, 3, 4, 5, 6. Okay. And then, after that, we will rinse the catheter and the connecting tubing into the water or the normal saline solution. Okay. Let's rinse it. Then, after rinsing the catheter, we will place it in a clean, dry area. And then, we will remove our gloves to avoid the transmission of infection. And we will wash our hands to deter the transmission of microorganisms. So, we're done washing our hands. Next and lastly, we will document the findings such as, of course, the indication of the procedure, the date and time of the procedure. You'll write April 17, 2021 at exactly 9:38 p.m. And then, the characteristic of the secretion, the amount, color, odor, and consistency. Let's say that the secretion is yellow, foul smell, thickened. And then, next, also we will note the vital signs of the client before, during, and after the procedure. So, we will write the temperature, respiratory rate, heart rate, and others. And then, the resolution or persistence of the reason for suctioning. And last, the client's comfort during the procedure. So we're done documenting. That's all for our newborn suctioning. I hope you've learned something in this video. Thank you.